Assalamu alaikum, this is Shama and today we are starting a new electrolyte, that is potassium. We have discussed magnesium, so if you have not seen it, please go back and see the videos. So today we'll focus on basically what is potassium, where it is located, and then we'll focus mainly on how it is regulated in the body in tight normal values. So let's start a discussion. First of all, what is basically potassium? So potassium is basically, first important point over it, it is an intracellular most common. So it is basically first most common intracellular cation of our body. Fine. So from this line it's very evident that what is the location of potassium in the body. Its location is of course present within the cells. So what is its location? It is present in the all cells of our body. Fine. Now we'll discuss that some of basic introductions over it, that what are its normal values. It's 3.5 to 5 milli equivalent per liter. So you can write 3.5 to 5 millimole or milli equivalent per liter. It's its normal values. Fine. Now let's start on the regulation of potassium in the body, and that is basically our main topic, potassium ion regulation in the body. Fine. So yes, let's just start a discussion. First of all, that is very important is that how potassium enters our body. First we'll take that, suppose this is our stomach, this is the intestine, this is our large intestine here. So here goes, I think it's a bit bad drawing, but okay, this is, I have tried to make GIT tract, first important organ from where the potassium ions through our mouth enters the body in the diet and is absorbed from the small intestine, and this is the role of GIT tract. So it absorbs it too, plus it excretes it too. Fine. And its excretion is just, you can say, 9%. Second organ that we're going to discuss is the kidney. That is very important. This is its adrenal gland, this is the whole kidney, pelvis, ureter. So we're talking about the whole kidney. Fine. Kidney plays a major role in the excretion process of the potassium ions, and yeah. And third, which is it's not an organ, it's a process, that sweat. So some of the potassium ion is lost through, I think sweat should be blue, but ignore this brown color now. So yes, this is sweat. So a small amount is lost in the sweat. Okay, so I've made these three organs. So now how its whole regulation is occurring is that, okay, first of all, we have eaten a diet containing potassium, and potassium comes through our mouth into the GIT tract. From there it is absorbed. Fine. Now only 9% of it will be excreted by the GIT tract, and major 90% of the potassium, whether it will be increased reabsorbed or less reabsorbed, and resultant there will be excretion of potassium, which is basically called the secretion of potassium in the tubular fluid. So it occurs from the kidneys. Moving on to the sweat, so only just a few percent, you can say 1 to 2%, that is excreted in the sweat. So now we'll discuss that this is the whole regulation. Basically we'll major focus on the kidney for this, because the major regulation mechanisms, they occur within the kidney. So where in the kidney? A question arises that, okay, in the kidney, but what is the location where the major regulation occurs in the kidney? So let's just make a nephron and see how is potassium moving in the nephron. Fine. So imagine this is the Bowman capsule. I'll make a very simple one. This is the proximal convoluted tubule. Here is the loop of Henle. Moving down, this is the thick ascending limb of loop of Henle, and here is the distal convoluted tubule up to the collecting duct. So here is our efferent arteriole coming, and this is the efferent arteriole. Fine. So now important part starts, that suppose I'm making it with green. Whole our potassium that was entered through the diet in the GIT tract absorbed from there and entered the blood. That potassium which is now circulating in the blood comes to the renal artery, of course back to the heart, and from heart to the left ventricle it comes to the renal artery, and the renal artery to the efferent arteriole. Now this potassium that comes here is at this point where this is a point where filtration occurs at the level of Bowman capsule and the glomerular capillaries, their filtration. So here potassium ion is freely filtered. So almost all that is coming is filtered here. Fine. Now in this proximal convoluted tubule, 65% of the potassium is reabsorbed back into the blood. In this thick ascending limb of loop of Henle, the remaining 15% is absorbed back into the blood. Now these absorptions, they normally occur whatever the blood will come there, these potassium ion will be freely filtered, 65% absorbed here, 15% absorbed here. So these absorptions will occur, but the question arises in your mind that what is the site in the kidney where it is regulated, means excreted. So this is the distal convoluted tubule and the collecting duct. So basically it's the distal convoluted tubule and the early collecting duct where the potassium is secreted. I repeat, its secretion means, what is secretion? Whenever a fluid or a substance or an ion, it moves from the blood into the tubule to be excreted in the urine, then it is called secretion. Fine. So here there will be secretion of the potassium into the tubular lumen and some into the from the collecting ducts also. Now the amount that is secreted here is basically dependent on the amount that is present in our body. So these two levels, they will perform the action of tight regulation of the potassium levels depending on the need, because of course if I have excess then I can easily lose it because I don't need that excess amount in my body. So this is a very basic concept that you should remember. So now we'll just discuss a cell of distal convoluted tubule and see how it is regulated there. Fine. So I'll draw a cell in front of you, just a small cell of this distal convoluted tubule. It is drawn here down. So suppose this is that cell of distal convoluted tubule, this is the blood vessel moving, and this is the tubular lumen. Now we're going to discuss that how the movement of potassium occurs, how the secretion of potassium occurs, and what are the factors that influence that secretion. And I'll just help you memorize in just a few minutes by just seeing this diagram. So please just listen very carefully. It is a very, very, very important point that will help you in all the whole story of potassium. So this I have made the lumen of the tubules. This is a blood, of course, capillary. So this is the distal convoluted tubule cell. Now the part of the cell that is towards the lumen, we call it the luminal side, and the part that is toward the blood vessel, we call it, from B, blood, or towards the body. So by B you can easily remember that it's the basolateral side of the cell, just to remember for a quick recall. Now what is happening here, that from the lumen we know that we have to absorb sodium from the lumen into our body. So here is a channel, this, it is called ENAC channel. So it's the name of the channel. But what it does is that it absorbs sodium ions into the distal convoluted tubular cell through this channel. Now on the basolateral side there is a pump, very common pump, you all know. It's sodium potassium ATPase pump. Now what is its name? Sodium potassium ATPase pump. Now what is the function of this pump? What it does is that this sodium ion, which is absorbed from the tubular lumen into the cell, it then moves here. So 3 sodium ions are pumped into the lumen in exchange for 2 potassium ions coming into the cell. Fine. So these 2 potassium ions come into the cell, which is then of course secreted in this lumen by of course a channel, which is, its name is ROMK. So this is the name of that channel. This potassium is then secreted in the lumen here. So this is basically what is happening here in the distal convoluted tubular cell. And now this is how sodium is absorbed and potassium is secreted. Now the amount of this potassium that is secreted here in the tubular lumen is dependent on a number of factors. Now we will discuss those factors. So what are the factors? To remember, there are 3 factors on the basolateral side, of course, in our blood related factors, and 2 factors are the lumen related factors. Now what are the blood related factors? Just remember or recall a simple theme that whenever something is in excess in my body, I'll just write here, whenever something is in excess, I easily lose it because I don't want it. Fine. Just a simple mnemonic to remember it very easily. Now what will be in excess? First of all, we are losing potassium here. So of course when there is increased potassium in the blood, we easily lose this potassium. So this potassium secretion rate is increased if there is hyperkalemia. Okay. Now second condition is when there is increased pH. First is this. Second is when there is increased pH. Now what does increased pH means? That if there is alkalosis in the body, it also loses the potassium along with the hydrogen. It loses the potassium out of the body and exchange with hydrogen coming back to the body. So yes, that's important, is that alkalosis, it causes the potassium to lose out of the body. And third important factor is aldosterone. So we have already studied it in our physiology couple of years back. So what is aldosterone? It is a hormone that is released by the adrenal cortex from the zona glomerulosa, and what it does is that it absorbs sodium and excrete potassium. It absorbs sodium and excrete potassium from our body. So when this hormone is present in excess, there will be increased excretion of potassium, which will lead to hypokalemia. So 3 factors I explained here. What? Hyperkalemia. So increased potassium, increased pH, increased aldosterone. Coming on to these lumen side factors, what are those factors? First factor is the luminal charge. So the charge in the lumen. Now here in the distal convoluted tubule, there is the negative charge in the lumen. So I'll just make these small negative charges. There is negative charge in the lumen. Now any drug that will, or any substance that changes this luminal charge, I'll write here negative luminal charge changing drugs, or anything who alter the negative luminal charge. Now what will happen if this negative luminal charge is present? That is present normally, potassium can easily excrete here. So if this luminal charge is altered, then it can also cause change in the potassium excretion. Fine. And another point is the sodium amount of sodium and water that is reaching the distal convoluted tubule. And we know in the distal convoluted tubule there are juxtaglomerular cells, macular densa cells that senses them, and accordingly GFR is adjusted. So yes, these are the 2 factors that influence the potassium secretion in the lumen and hence out of the body. So here we have discussed the whole potassium regulation, how it is regulated within the kidney, and we have discussed the factors that influence those regulation mechanisms. Now talking about the 2 others that are left, that is GIT and sweat. GIT is that if there is excessive, we can say that if there is excessive diarrhea. Now these are the conditions which we will discuss in hypokalemia in more detail, but yes, any condition that causes increased loss from the GI tract, diarrhea or laxatives or enema or anything, so or any condition that like vomiting. So it can, these all can lead to excretion of potassium from the body, and hence hypokalemia can occur. Basically the excretion is occurring through GIT by these routes. And in the sweat is like when the patient is doing excessive workout in a hot climate, then he'll sweat a lot, and in the sweat some amount of potassium is excreted. So just this is the whole brief overview of the regulation of potassium ions in the body. Three major organs, just a quick summary: three major organs that are controlling it: the GIT tract, from where it is excreted just 9%, in the kidneys 90% is excreted, and in the sweat a small amount, 1 to 2% is excreted in the sweat. Mechanisms I've explained here, and the factors are the hyperkalemia, alkalosis, aldosterone. Now yes, one point here, that these factors which I discussed before, this hyperkalemia and pH, these are the all factors that causes increased loss. So opposite to these, if it's hypokalemia or acidosis or decreased aldosterone, then it will cause increased retention of potassium, which can cause of course hyperkalemia in the body. Plus these luminal charge changing drugs, like suppose if the patient is taking this, is performed by the potassium sparing diuretics which are called amiloride. So it changes the luminal charge, and they can cause then hyperkalemia. So yes, this is how the potassium is regulated in the body. And just at the end, the tight regulation occurs in distal convoluted tubule and the early collecting ducts of the kidney. So I hope many of the concepts of the potassium regulation will be clear now, and this video will help you out. If it does so, please just like, share and subscribe, and keep supporting. Thank you so much. Allah Hafiz. See you in the next video.